everyone. Welcome to Strategies for Managing Difficult Clinical Research Sites. I'm Nazma Rosado, and I will be your facilitator today. Here's a little bit of information about me. Basically, I have seen and worked with difficult sites in a variety of ways, either in a position as a CRA, as a study manager, a project manager, program manager, small biotechs, large biopharmas, even with CROs. I've maybe every type of difficult site there is, I've encountered it. And I'm sure that's probably not so dissimilar as what you might feel in your interactions with sites. Now, there are some fantastic sites out there, some sites that have really involved PIs, very seasoned and skilled coordinators, people who are just, really trying to do the right things and the best work possible, who partner with us almost seamlessly. And then there are some sites that have challenges that we need to work with them on, all of us getting over, in order for us to have a successful end result for our clinical study. The learning objectives for today's class, we have just 2 short hours, but it should be pretty well jam-packed with information. We are going to define some of the causes why we might perceive sites to be difficult. We're also going to address different approaches for dealing with these types of sites, right? It's not a one-size-fits-all or one solution can solve it all sort of situation. We will look at developing some trending techniques in order to be a little bit more proactive and anticipate site issues. We'll look at implementing proactive diagnosis techniques in order for us to develop a clear CRA communication plan. And then we'll talk about some techniques that exist for resolving conflict and for promoting successful outcomes. So all of these things are topics we're going to dive into today. I do want to say to you that although I have slides with words on them. This is a small group. It's just really, the 4 of us. And so I invite you to interrupt me at any point in time. You could just raise your hand or put something into the chat. If you have a question or if you have a relevant story to whichever topic we're discussing. I love when our classes are a little bit smaller because they're a bit more intimate, and that allows for us to really do some storytelling and look at real-world examples, so that we're not, purely tied to the slides, but you're also learning from one another, okay? So I really invite you to actively participate. So when it comes to sites and working with sites, many CRAs ask the question of, how do I best handle a difficult site, which is where this course comes from, right? Instead of realizing that many people have the same question. It's not only CRAs, but also site support folks as well, and even study managers, right, who are calling in at times to those sites to check in on what do they need and how can we best support them. So some of the things that we often hear is that difficult sites exist, and they are extremely challenging, and there are so many different elements that might make a site a challenging site. So difficult sites, it's not actually surprising to hear that, because it's one of the largest contributing factors. So why CRAs sometimes feel like, monitoring is no longer fun, right? It's very much a challenge, because if they're out there and they're, at the site, and the site isn't willing to do what's necessary, right? The PI is too absent, isn't there to sign off or to meet with you or to have discussions that need to be had. If the study coordinator is kind of, just ignoring you or making you feel like you're a nuisance and being in their presence, or just really isn't prepared for your visit, any of those things, it's really sort of an awkward position to be in. And it also is just a waste of your time, right? And a build on your frustrations. So it's one of those spaces where CRAs tend to feel like they're unsupported, because usually when you're out on the site, you're out on the site monitoring on your own, right? So now we do some more remote monitoring. We're doing more risk-based monitoring than 100% source data verification. But way back in the olden days when I was a CRA, we go to the site, it was 100% source data verification. We were there for a day, maybe 2. Not the best conditions oftentimes. You're crammed into a filing room or a coffee room, or sometimes even, seated on on an examination table, just trying to go through all the charts and make sure everything is how they should be. Now, things are much more evolved and different. However, there's still that situation that exists. If you are site-facing and you're working with a difficult site, the coordinator or the PI or anyone else from that site, right? It's just a really difficult space to be in. So I won't ask I guess the very obvious question of, is this relatable? Because I know, after having been in that role, I know it's very awkward. And even for those of you who are in the site support space, right, site network coordinator as well, your ability to calm the storm when things are sort of kicking up a little bit is not any different, right? You're sort of feeling like, okay, the site is not really well prepared, or despite my best efforts, the site is not listening or not responding or whatever it is, in which case it just makes things much more difficult. So I know that it is a relatable question. We also have, many CRAs saying, well, it's kind of hard to define and to talk about a difficult site because sometimes the site is overwhelmed, right? They're the right people, they're good people. There's just too much throughput happening at this time, or they've sort of split themselves up across too many studies from various sponsors at the same time. Sometimes it's that the site's not motivated, and how can I motivate this site, right? What is it that I can say? What is it that I can do? How can I best support them, and how can I try to motivate them better? The thing about that is, we don't want to motivate them just for high throughput, just so that there's, a whole lot more people that they're screening, because we don't want to be in that garbage in, garbage out situation where it's just a whole ton of screen fails, right? That's not the kind of motivation that we want to spark. We want to ignite in them that passion for assuring that the right patients are coming in and being screened, and then hopefully being enrolled and being treated fairly and according to protocol. So motivating sites, it's interesting because I know CRAs who have been a little bit caught between a rock and a hard place, where it's not really clear what is meant by motivate the site. Sometimes what they're hearing from the study managers and the program managers internally is, we've got to get more patients enrolled at these sites, and that might translate into screen more patients, right?